Welcome back to the channel. Our today's topic of discussion is anatomy of external auditory canal. So, external auditory canal is about 24 millimeter in length and it extends from concha laterally to tympanic membrane medially. And its total length is 24 millimeter. And it can be divided into outer 1/3 and inner 2/3. So the outer 1/3 is cartilaginous and inner 2/3 is bony. The direction of EAC is not straight. It is not straight, but it is S-shaped. The outer 1/3 cartilaginous part is directed upwards, backwards, and medially, while the inner 2/3 is directed downwards, forwards, and medially. Suppose this is the pinna and this is the concha. So this is the outer 1/3 which is cartilaginous and this is the inner 2/3 which is bony. So as you can see, the direction over here, the outer 1/3, it is bit upward, it is backward and also medially, while that of the inner 2/3, it is downward and it is forward and also medially. So for examination of tympanic membrane, the pinna is pulled upwards, backwards and laterally, so that both the cartilaginous and bony EAC are aligned. So when we pull the ear laterally, upwards and backwards, the EAC gets kind of in a straight line, so we can visualize the tympanic membrane well. So talking about the cartilaginous EAC, it is a continuation of the cartilage which forms the framework of pinna. So basically it's a continuation of the cartilage of pinna. So in the floor of the cartilaginous EAC, we see transverse slit-like structures which are known as fissures of Santorini. So basically they provide passages for infections and neoplasms to and fro from surrounding soft tissues. The skin of the cartilaginous canal, it is thick. So the skin is thick and it contains cerumen which is secreted from ceruminous and pilosebaceous glands. The cerumen has a pH of around 6 to 6.5, which is acidic and hydrophobic. The bony EAC is mainly formed by the tympanic portion of temporal bone, but the roof is formed by squamous part of temporal bone. The skin of the EAC, the bony EAC, is thin relative to that of the cartilaginous EAC, and it is devoid of any subcutaneous layer. It doesn't have hair follicles, and obviously it doesn't have ceruminous glands. So no subcutaneous layer, no hair follicles, no ceruminous glands. Next is isthmus. So isthmus is a narrowing of the bony EAC, which is 6 mm lateral to tympanic membrane. And if a foreign body is impacted in the isthmus, it is very difficult to remove. So in children and occasionally in adults, there is a deficiency in antero-inferior bony EAC, which is known as foramen of Huschke. So through this foramen of Huschke, infections can spread to and fro from the EAC and parotid glands. Next is the relation of bony EAC. So superiorly it is bounded by middle cranial fossa, inferiorly by parotid gland, posteriorly by mastoid antrum and ear cells and facial nerve, anteriorly by temporomandibular joint, also known as TMJ, medially by tympanic membrane, and laterally by cartilaginous external auditory canal. So this was in short anatomy of external auditory canal. Thank you for watching. See you in the next video.